Hello, Professor. My name is Irene Granados, and I am here to do my medication teaching video. So the medication I decided to do, it is Lexapro. The generic name is escitalopram, and the class, it is a selective serotonin reuptake inhibitor, otherwise known as an SSRI. The reason why I mostly chose this medication is because I am currently taking the medication. I've been barely starting to take the medication, so I'm pretty aware of the side effects. And then I have here as my little guest patient, it is with Snoopy, and they're going to be my patient for today. I'm kind of doing it like if it is a telehealth appointment, just to go over the medication. And then I'll go ahead and begin my video. Hello, hi, my name is Irene Granados, and I am here as your nurse to go ahead and discuss about a new medication that you're going to go ahead and take. So the name of the medication, it is called Lexapro. It's otherwise known as escitalopram. This medication is used to treat depression and anxiety. It helps improve mood, reduce feelings of worry, and it can help you enjoy your activities again. So Lexapro works by increasing the amount of serotonin. It is a natural chemical in your brain that helps regulate mood. It may take around 2 to 6 weeks before you actually notice the full benefits, so it is really important to keep taking it even if you do not feel better right away. You will take Lexapro by mouth once a day, usually in the morning or in the evening. It just depends on your healthcare provider's instructions. You may take it with or without food, but try to take it at the same time every day. Do not stop taking this medication suddenly without talking to your healthcare provider, because stopping it too quickly can cause withdrawal symptoms such as dizziness, headache, irritability, or flu-like symptoms. Some common side effects do include nausea and drowsiness or feeling tired. These side effects are often mild and may improve as your body adjusts to the medication. If they do become severe, do not go away. Just go ahead and let your provider know to go ahead and schedule an appointment for an additional assessment. I just want to let you know, especially if you want to pay attention to your prescription bottles. Normally, it will go ahead and tell you the name of the medication, followed by the instructions. And then you'll also see here of just the side effects, just in case if you have forgotten. And then I do have two major safety concerns, especially that I wanted to go ahead and discuss with you, Snoopy. Just because since you are an older adult, we just want to go ahead and really highlight and emphasize. One of the big ones is the risk for falls, especially when starting the medication, just or if it's the dose does get increased, just because it does cause dizziness or sleepiness. To help prevent falls, we'll just have you stand up slowly from sitting or lying down. And if you do feel like you need assistance, please go ahead and feel free to use it, just so in case if you need any additional help. Another safety concern that I'll go ahead and discuss with you, Snoopy, is just that older adults taking Lexapro, they might go ahead and develop low sodium levels, so which can cause confusion, weakness, headaches, or increased sleepiness. So if you do happen to notice these symptoms, please let us know or contact your healthcare provider right away. Just to make sure I explain this clearly, Snoopy, can you tell me your old words when you will take your Lexapro and what side effects or safety concerns you should go ahead and watch for? Yes, I will take Lexapro once a day at the same time every day. I will go ahead and watch for symptoms such as nausea, feeling sleepy, or dizzy, and I will be careful standing up because I could fall. If I do become confused, very weak, or have severe side effects, I'll contact my healthcare provider. I also won't stop taking the medication without talking to my provider. Thank you for providing me that information, Snoopy. And then normally, let's say if the patient did have any problem answering, I would review the information again and just go ahead and ask the question a second time until they go ahead and explain it correctly in their own words. If the response is incorrect, I would clarify and just provide any additional teaching. Well, thank you, Mr. Snoopy. If you do happen to have questions or notice any new worsening symptoms, please go ahead and contact your healthcare provider. Taking your medication exactly as prescribed and keeping your follow-up appointments will help you stay safe and get the best results from your treatment. And that concludes my video.